Hello everyone. Thank you for listening to the video on infections. Do you have any questions? Maria, please go first.
Yes, Mr. Booty. You mentioned 4 types of pathogens. Can you explain the difference between bacteria and viruses again? It is sometimes confusing.
That is a great question, Maria. Bacteria are single-celled organisms. They can live outside the body. Some are good, but some cause diseases like strep throat. Viruses are much smaller. They cannot live alone. They need a living cell to multiply. Examples are the flu or COVID-19. So remember, bacteria are cells. Viruses need a host cell.
I have a question about treatment. As a pharmacy student, why is it dangerous to use antibiotics for viral infections?
Excellent point, Kenji. Antibiotics only kill bacteria. They do not work on viruses. If you take antibiotics for a virus, like the common cold, the medicine does nothing to help you. Worse, it can cause antibiotic resistance. This means bacteria learn to survive the medicine. Then, when you really need antibiotics for a bacterial infection, they might not work.
I am interested in prevention. You talked about modes of transmission. What is the difference between droplet and airborne transmission?
Good question, Rena. Droplet transmission happens when a sick person coughs or sneezes. The droplets are heavy. They fall to the ground quickly. You must be close to the person to get sick. Airborne transmission is different. Tiny particles stay in the air for a long time. You can breathe them in even if the sick person left the room hours ago. Tuberculosis is an example of airborne transmission.
Mr. Booty, regarding prevention, is hand hygiene really the most important method?
Yes, Bob. Washing hands with soap and water removes pathogens from your skin. It stops indirect contact transmission. For example, if you touch a dirty doorknob and then touch your face, you can get sick. Hand hygiene breaks this chain. It is simple, cheap, and very effective for nurses and doctors.
Finally, what about fungal infections? How do we treat them?
Fungal infections, like athlete's foot or yeast infections, are treated with antifungal medicines. For skin problems, we often use creams. For serious lung infections in patients with weak immune systems, we use pills or IV medicine. It depends on how severe the infection is. Thank you all for these excellent questions. Remember, know the pathogen, stop the transmission, prevent where possible, and treat correctly. This will help you in your future careers. See you next class.
Comprehension questions. Once you've finished watching the video, please respond to the questions below. 1. According to the script, what is the main structural difference between bacteria and viruses? 2. Why should pharmacists advise patients not to take antibiotics for a viral infection like the common cold? 3. Explain the difference between droplet transmission and airborne transmission using an example from the text. 4. Why is hand hygiene considered the most important method for preventing indirect contact transmission? 5. List 2 examples of vector-borne diseases mentioned in the original video text and identify the vector, carrier, for each. 6. How does the treatment for a fungal infection differ depending on the severity of the illness?
Great job finishing the questions. To take your learning one step further, review the academic reference listed below. This resource was chosen to support your ESP studies and to give you reliable, evidence-based information that you can use in your future work as a medical, nursing, or pharmacy professional.
This video was created using artificial intelligence for educational purposes only. It is not a real recording, and any resemblance to actual persons or events is coincidental. Some images are purposely used with consent. The content is intended solely as a learning resource.
Practice is the key to mastery. Every effort, no matter how small, gets you closer to perfection. Keep going. Your dedication will pay off. Latihan adalah kunci menuju penguasaan keterampilan berbahasa. Setiap usaha, sekecil apapun, membawa Anda lebih dekat ke kesempurnaan. Teruslah maju, dedikasi Anda akan membuahkan hasil. Salam dari Pak Budi.
This video was created using artificial intelligence for educational purposes only. It is not a real recording, and any resemblance to actual persons or events is coincidental. Some images are purposely used with consent. The content is intended solely as a learning resource.
Practice is the key to mastery. Every effort, no matter how small, gets you closer to perfection. Keep going. Your dedication will pay off. Latihan adalah kunci menuju penguasaan keterampilan berbahasa. Setiap usaha, sekecil apapun, membawa Anda lebih dekat ke kesempurnaan. Teruslah maju, dedikasi Anda akan membuahkan hasil. Salam dari Pak Budi.